start from there.
Okay. So we're starting a little bit from, I'm sorry, I'm getting a little bit, trying to take a few deep breaths and start all over again. So here we are today talking about the expansion opportunity through the Home Visiting Services account. On Monday, we'll be running a second webinar, Bidders Conference, to discuss the startup installation funding opportunity. So you're welcome to participate in both, but just wanted to address any clarification. If you think you're on the startup, you're not, you're on the expansion. Okay, let's start. I just wanted to start with a poll. Here's a chance for you to just tell us a little bit, one little detail about who you are. What we're interested in knowing is if your organization right now is currently part of the HVSA family. So that means, are you receiving funds from Department of Children, Youth, and Families to deliver home visiting services through the Home Visiting Services account? So I think you have an opportunity to answer yes or no. Or maybe it's not working. Poll in progress, distributing poll.
It says it's distributing.
So over to the right, you have an opportunity to choose yes or no, but it's not working. Okay. We're really having good luck today so far. Okay, well, I guess we could move on. Close the poll since it's not working. All right, so here's today's agenda. We're going to start out just with an introduction, which kind of has failed miserably so far. Give you a little bit of an overview of the Home Visiting Services account if you're new. Give a general description of the funding opportunity. Highlights of the application questions in the process, and answer some of your questions. We'll be working through the slides right now and then taking questions at the end. We've set aside a lot of time for questions, so please hold on to your questions and chat those in during the question section of the webinar. And another reminder, we're recording this webinar and we'll be posting the audio as well as the slides on the DCYF webpage, the home visiting page within that. All right, let's go to the next slide. Are we having more technical problems?
Yeah, it's advancing on mine and not on theirs. Still stuck on the welcome screen.
But you're in charge.
And I'm sharing my screen. Can you? Stop and start.
You can have them.
Yvonne, do you want to share your screen?
It's in, do you know where to find it? It's in the communications folder, not in the webinar. It's under home visiting, communications, webinar. Sorry about all these technical difficulties. This is an unusually challenging day.
Yeah, it shows that I'm doing it all.
So you're going to make her a presenter?
I already did. She's
Okay.
an organizer as well.
Home visiting, webinar, or communication, sorry. So now, I really don't like this view of myself.
Yeah, they can follow along in the PDF, but I just.
Okay, so I guess how we're going to approach this is if we're having trouble sharing screens, so if you can open the PDF document and follow along, we're currently on the 5th slide, entitled Home Visiting Services Account, HVSA. Thank you. So in 2010, the Washington State Legislature established the Home Visiting Services Account, which we call the HVSA. And the purpose of that account was to increase the availability of high-quality, evidence-based, research-based, and promising home visiting practices in Washington State. The HVSA currently holds 39 contracts with local implementing agencies, so LIAs. That's one of our jargon terms. Our annual investment right now is $10.8 million in direct services, and we expect through this procurement it will go up another 1.5 million next year. The actual home visiting services account resides within the Washington State Treasury and is administered by the Department of Children, Youth, and Families. But HVSA legislation guides the expenditures, the bid process, and the values of this work. The HVSA is overseen by a partnership group that consists of the secretaries of the Department of Children, Youth, and Families, Department of Health, and the Department of Social and Health Services, as well as the executive director of Thrive Washington. So you'll note that we have 3 logos down on the bottom of all of our slides indicating there's a trio of folks who are of organizations that work together to manage and support the HVSA. We work in close partnership with each other. Next slide, number 7. According to legislation, the HVSA funds must be used for the implementation of evidence-based, research-based, and promising home visiting models. Our overarching goals are to enhance child development and well-being, alleviate the effects of poverty and other known risk factors, reduce the incidence of child abuse and neglect, and promote school readiness for children and their families. The HVSA legislation specifies that funds must be administered through a competitive bid process. Next slide, number 8. So the vision of the Department of Children, Youth, and Families is that all Washington's children and youth will grow up safely and healthy, thriving physically, emotionally, and educationally, nurtured by family and community. So this vision aligns with the goals and values of the HVSA. HVSA investments are informed by the values that you see listed on this screen. These values were developed through collaborative work of Washington's many home visiting stakeholders. They can't hear? Including the Home Visiting HVSA Advisory Committee. This is really tough to do this webinar right now. I can't even finish the sentence. People can hear? They can't hear.
Sandra just said that she could hear.
Well, we'll just keep going.
Just talk with her.
I'm having a hard time believing people can't hear my voice. Probably if everyone were quiet, you could hear me across the state of Washington without being mic'd. I have such a loud voice. Anyway, so what I was saying is that we have these values that were developed through a collaborative approach of stakeholders across the state, and they inform all of our funding approaches. For example, we take a portfolio approach to funding, which means funding a range of home visiting models to meet the diverse needs across communities in Washington. We want diverse representation across all the geographic, racial, and cultural communities in Washington State. We fund a range of capacity from small to large organizations, and we encourage and foster partnership and relationships between our contractors, technical assistance providers, continuous quality improvement and evaluation work. So the idea is we're partners together. We can go to the next slide, which now I believe is slide 8, outcomes. Over the years, the HVSA has developed an aligned evaluation framework for home visiting programs to measure the impact of home visiting based on the first established by our federal funder, the Maternal, Infant, and Early Childhood Home Visiting Program that's administered through HRSA at the federal level. And we've aligned those outcomes across all of our home visiting programs in Washington State to create what we call an aligned framework. Our framework looks at the domains we have listed on this slide: improving maternal and newborn health, preventing childhood injuries, child abuse and neglect, maltreatment, and reducing emergency department visits, improving school readiness and achievement, reduction in crime or domestic violence, improvements in family economic self-sufficiency, and improving coordination and referrals for other community resources and supports. In order to measure and track these outcomes, all contractors who receive HVSA funds agree to collect and share data on aligned measures. These measures include breastfeeding, depression screening, well child visits, child maltreatment, parent-child interactions, early language and literacy activities, developmental screening, intimate partner violence screening. Programs are also asked to collect and report on participant demographics and service utilization, all building what we call an outcomes framework for home visiting. Now this is going to be real challenging. It's Thrive's turn to present, and hopefully,
should we just say what page she's on?
We're on page 9. It starts as implementation science.
I just need to unmute Liv 1 second.
So we're going to unmute Thrive. Liv?
Oh, great. Can you hear me?
Yep, we can hear you.
Okay, great. Technology, friend or foe? We'll try to make this clear, and I'll speed through this because I know we've got a lot to cover today. So I'm going to talk, this is Liv at Thrive Washington, and we're going to just provide a brief overview of implementation science, and then that kind of bridges into the training and technical assistance team that we have here at the Home Visiting Implementation Hub. So a broad overview: implementation science is a body of research held by the University of North Carolina on the factors that lead to effective implementation of a specific intervention. The HVSA, in particular the Hub, uses this framework for how we support home visiting programs in Washington. While there are many components of implementation science, the ones we utilize most are implementation stages and implementation drivers. And I go to the next slide, which is slide 11. So you'll see here that implementation science breaks the process of implementation into 4 stages: exploration, or basically looking to start up a new service; installing of a new service; initially implementing; and then fully implementing. We know that programs require different levels of support depending on what stage of implementation they're in. The Hub has also added 2 additional stages, which is fully implementing expanding of your service, and then also fully implementing staff transition. We've added these 2 stages because for home visiting, we see that there are very distinct time periods that impact service delivery and the kinds of supports that are needed by programs. If you're awarded funding through this expansion opportunity, you and your technical assistance provider will talk through the impacts of this expansion on your program structure and enrollment. Going to slide 12. So implementation science also describes key drivers that lead to success in implementing an intervention. You'll see them here on the screen. We have customized these key drivers and added another driver category called connection to community. Again, we've done that because we can see for home visiting specifically how a program is integrated within the community is essential for success. With all of this in mind, every year programs submit a self-reflection tool where they assess where they are at with these different drivers and stages, and then together the TA provider and the home visiting program use this to create an individual technical assistance plan for the year that addresses each program's unique needs and strengths. So the next slide slide 13, is just a really brief overview on the different types of things that the Implementation Hub supports. So you'll see that in general, we look at model fidelity, continuous quality improvement, and of course, we're using an implementation science lens. So you'll see that with these kind of approaches, we're also looking at training and ongoing coaching, as well as providing communities of practice to support service delivery and the needs of providers. I'm going to the next slide, slide 13. All awarded grantees are required to participate in all aspects of Implementation Hub technical assistance. And you'll also note that in general, our team is really here to provide supports for infrastructure for home visiting programs, including training, quality improvement, and evaluation, which is part of what's in the HVSA statute. So in the next slide, slide 14, you'll see the list of our Hub technical assistance members that in particular will be helpful as you think about expanding your program. So feel free to connect with the appropriate resource in terms of model expertise or program expertise as you think through guidance and the next steps for pursuing your application. And I think that's me, and I'm passing it on.
Yay, thanks, Liv.
Thank you.
So the next slide, slide 15. Oh, let me just say one thing. We're going to re-record a version of this, hopefully without the technical snafus, and post that on the web. But again, you've got the slides and you can listen to us, and certainly you can chat in any questions that are related to the application or the application process. You can certainly email us any questions as well. So if anything is unclear through this challenged presentation, we'll work to address that unclarity later. The next slide is entitled Department of Health, and Department of Health is responsible for leading the data monitoring and evaluation efforts of the HVSA. This includes data sharing agreements with each program that facilitates sharing of program data with Department of Health. And then they also manage the data processing and reporting to meet state and national funding requirements. DOH staff work very closely with funded programs to ensure complete and timely data collection and reporting. And they also provide data back to programs in the form of dashboards as well as other products to support continuous quality improvement and an understanding overall of our efforts that towards our long-term outcomes. Next slide. So that's all by way of background of the Home Visiting Services account. In Washington State, in 2017, the Department of Early Learning conducted a home visiting scan where we identified that funded through state dollars, there were 8,852 home visiting slots. Essentially, that means there's a place to serve that many families at any given time across 9 models in Washington State. The home visiting scan can actually be found on the home visiting page of the DCYF website if you want more information about that. And it depicts all of those programs funded with state dollars. Currently, through the HVSA funds, we fund about 2,100 slots. So that amounts to about 25%, not quite, of all the voluntary early childhood home visiting slots in Washington State. While that's, so we're seeing that we serve around across the state 8,800 families at any given time. Also in 2017, the Department of Early Learning, along with the Department of Health, the Department of Health actually conducted a home visiting needs assessment. And in that process, they identified that 127 families would benefit from home visiting. In other words, they're eligible and they demonstrated certain risks that would make home visiting a service that would be of use to them. So we can see that the availability of home visiting slots compared to the need is there's a stark contrast. During the legislative session of this past year, the legislature authorized an additional $1.5 million in funds to expand the reach of home visiting. These funds are the source of this funding opportunity that we're talking about today. We're running 2 separate procurements at the same time. $1 million to expand slots in existing home visiting programs, which is this funding opportunity, and $500,000 for startup installation of new home visiting programs. Okay. So for this funding opportunity, we have $1 million available per year. Applicants may each request up to $200,000 per year to cover ongoing annual expenses. Because we're running this procurement mid-year and follow the state fiscal year, it's a little bit wonky, and it means that the first year is really only going to translate into 7 months of funding. So for those folks that are successful, the first contract term will run from December 1st, 2018 through June 30th, 2019. And your contract award will basically represent those costs that it takes to start up, really expand your program into full implementation of this expansion during that 7-month period. So it'll include 7 months of ongoing operational expenses and any additional expenses related to startup and ramp up. The second term of the contract, or the second year, will initiate on July 1st, 2019 and run through June 30th, 2020, a 12-month period. That period, your annual expenses cannot exceed $200,000. Okay. We'll go to the next slide, slide number 18, eligible organizations. So this slide shows the list of those types of organizations that are eligible to apply for expansion fundings. To fit within the expansion category, your organization must currently be delivering home visiting services, and you're proposing to expand to serve more families. So we can go to the next slide. Slide number 19, if my numbers are right. So again, programs are eligible to apply under this procurement if they intend to expand the number of families they serve under their existing model, and if they have been fully operational for at least 1 year. So being fully operational means, so this is, we're going to go back to the implementation science. You're at full expansion on that model of implementation science. So you are in full model fidelity. So you've been in good standing with meeting all of your model requirements. You're fully staffed. You're reaching your goal participation level and enrollment levels, and you're in compliance otherwise with any other expectations of your model or your funder. So you're operating at full capacity, and you've been operating at full capacity for a year. In addition, because of our priorities, you're serving children ages prenatally, really, through 4 years old, which means up to a child's 5th birthday. So the funds in this opportunity may not be used to supplant existing funds directed at home visiting. So they're really intended to expand the number of families served, not replace some other fund source. I think okay, now I see it. So we're going to move on to slide 20, eligible home visiting models. I think I said at the beginning of the presentation that we were going to fund home visiting models that are currently operating in Washington State that are either evidence-based, research-based, or promising practices. And those programs are listed on this slide here. So under this procurement, you have to be implementing one of these program models to be eligible for this funding. We'll go to the next slide. A high priority of the HVSA is to be aiming their services at priority at-risk communities. So what we're going to be asking applicants to describe through the application process is the community need and risk context in which you're proposing your expansion. So you will need to also demonstrate how your expansion will address those risks and needs that you've identified, and how your proposed expansion will benefit families. The 2017 Home Visiting Needs Assessment will provide you with the tools to examine the needs and risks in your proposed expansion community. And we can go to the next slide, number 22. This is a teaser for on September 5th. We're going to be conducting another webinar related to this procurement, as well as for the startup applicants, where we're going to be talking about data monitoring and evaluation. At that time, we'll present the needs assessment in more depth and walk through a few examples of how an applicant might use the needs assessment to focus resources to populations who might benefit most. On behalf of the HVSA, the Department of Health conducted this needs assessment to understand the needs across the state and identify which communities might benefit from home visiting services. Through the needs assessment, they estimate the distribution of families across the state who will benefit. A successful applicant will really understand the needs of their community and will draw on this needs assessment and supplemental tools to support the assessment at the local level. So the final report, as well as other supplemental materials related to the needs assessment, are located on the DCYF website, the home visiting page, with the procurement documents. So you can go take a look there. And again, more information about this in more detail will occur during the September 5th webinar starting at 9:30. Let's go to the next slide, number 23. This slide is a long slide that lists the priority populations that the HVSA focuses its home visiting services. Now, your program does not need to serve every single category on this list, but participants within your program.
Can you go back one slide and repeat what you said?
Oh, you want me to?
Pause and then repeat that.
Oh, okay. So I'm supposed to repeat
Your last slide.
Just go
the
ahead.
needs assessment slide?
Mhm.
That was, okay, that was a long slide. Okay. So in 2017, the Department of Health, on behalf of the HVSA, completed a home visiting needs assessment to understand the needs across the state and to identify which communities might benefit from home visiting services. The needs assessment estimates the distribution of families who may benefit from home visiting. And successful applicants will really understand the needs of their community and draw on the needs assessment to support that assessment at the local level. The report, along with supplemental methods and data tables and a user's guide, are available on the home visiting page of the DCYF website. We'll be conducting a webinar that goes into more depth on this on September 5th at 9:30. During that time, we'll present the needs assessment and more in depth, and we'll walk through a few examples of how you might use the needs assessment data to focus resources to populations who might benefit most. So it's an opportunity to learn a lot more about it and how to use the data to support your application in this procurement. All right, slide 23. The HVSA prioritizes services to families who are vulnerable and experience high-risk circumstances or characteristics. So your program expansion will need to address at least one or more families who have one or more of these characteristics or circumstances. We don't expect each program to address every characteristic on this list, but every participant in your program should have at least one of these characteristics. I'm not going to read through them all. They're also listed in the application guidance document. HVSA priorities, slide 24. This is an overarching guide to you as an applicant to see what we're looking for amongst programs applying for funds. So these are I would say, the values or the priorities that rise to the top, kind of in frame all of the things I've just said to you. So think about these priorities and think about how you were going to express or respond, or kind of weave your answers to these characteristics. The first being community need. So we talked a little bit about that with the needs assessment and community unmet need. your application should evidence the need in your community that warrants or justifies expansion, and that demand for services currently exceeds supply. Your application wants to show that the model and your organization have fit within the proposed community. You have the capacity to serve the community in which you're proposing to serve, and that potentially have strong referral networks so you can better serve clients. We want to see supporting diverse communities so that you can effectively respond to the diverse needs of the clients through strength-based approaches, attention to cultural competency and alignment with the proposed service population, incorporating trauma-informed practices, and the like. We want to see an organization's commitment to home visiting, that your organization has a long-term commitment, that the proposed expansion advances the mission of your organization as well as your vision and values, and that you're willing to sustain high-quality programs without a guarantee of increased funding from the HVSA. Organizations will need to demonstrate their capacity to implement the services that you propose, both with financial stability and health. Your organization is equipped to manage a state contract, that you have infrastructure in place to implement a high-quality home visiting program, which would include fiscal management, human resources, the ability to recruit high-quality personnel, that you have data support, management, and administration. Your implementation plan clearly delineates how you plan to expand and sustain your program. We also want to see a commitment to implementation with quality, implementing things like continuous quality improvement, reflective supervision, ongoing training for staff, and really having a willingness to access technical assistance resources. We want all programs to contribute towards a strong, coordinated systems of services that support young children and their families, both locally, regionally, and then across the state. And then finally, organizations that are engaged and actually reflective, who will serve as a partner in the whole HVSA team to seek learning and improvements across the whole system. Reviewers will be balancing all of these priorities along with wanting to make sure the portfolio is balanced across program models, geography, and high-need communities. Again, I'll mention that amongst this procurement, the expansion and the startup, we're hoping to fund at least 25% of our funds towards promising practices and research-based practices. Right now, we have a heavier emphasis on the evidence-based program, so we're trying to balance that portfolio a little bit more. We like to see this balance across programs, types of organizations, and also throughout different geographic regions of the state. Okay, so that's more of the background. Now we're going to start talking about process. Yeah, that process for application. The first step is to complete the template that we've included in the application guidance, which is a letter of intent to apply. The letter of intent to apply is really for us, it's helping us as a planning tool to help build our review process for you. So we're asking you to submit by noon on August 30th. Fill out this form. It's just a simple template that pretty much asks your organization name, contact name, what you anticipate your budget will be, what you anticipate your service numbers will be. You will not be bound to any of that information. It's just a placeholder for us to help us plan. Again, due by August 30th, 2018. Next slide. Then we have our application. It's currently in a Word document. If you don't have it, you can download it on the home visiting webpage of the DCYF website. The application has 7 components to it. I'm going to go through each one of these except for the first one, which is basically the details of your organization. So it's pretty simple. But a hint, the application guidance document that we sent out in companionship with the application questions itself, offers a lot of helpful information both on how to respond to the questions in terms of how to answer them, and then the priorities that we're looking for to be successful. So that's a good document to read. So let's go to the next slide, which talks briefly about our project overview. This is just a high-level summary of who you are and what you're proposing. The next sections of the application will go into greater depth, but we want just what's your current home visiting program, a brief summary of that, and there's a few questions related to that, and then a brief summary of your expansion request, including an abstract of your proposal and your proposed budgets for both 7-month and the 12-month ongoing, and then how many families you expect to serve. Okay. The third section of the application is the place where you're going to profile your community. You're going to describe geographically your expansion area. You're going to describe a little bit about the existing services in that area, and you're going to go into great detail around your community need. Here's where you're going to use the 2017 needs assessment and potentially other local data to estimate the need and justify your proposed expansion. This is where we want to see a picture really of what's going on in your community, both what exists and what's needed, so we can understand better the context of your proposal. All right. Section 4, next slide, talks about your organization's capacity. This is the place where we're looking to see the house in which your home visiting program will be sitting. To be successful, home visiting programs must be housed within organizations that offer support and guidance from the policy and the program level. They can't do it off on their own as a separate entity or a separate arm of an organization. So in section 4, we're seeking to learn about the organization's management and structure, how the home visiting program fits within your overall strategic direction and priority. And we also want to learn about the home visiting program that you're going to be expanding. So here's where we're going to ask you the details about your current program. And then in the next section, we'll ask you about the expansion. On Tuesday, August 28th, we're hosting another webinar that's really focusing on organizational expectations for the HVSA. So here's where you might get an idea of what it means to be part of the DCYF contracting system and a little bit more information around organizational capacity needed to support a home visiting program. Next slide is the implementation plan. And the implementation plan really foreshadows the elements of the statement of work that will be in your contract if you're a successful applicant. This is the nitty-gritty of how you plan to expand. You want it to be well-devised and thought out and complete. So we've got a number of elements. It's quite long. You have to think through each one, and I think hopefully we've set it out in a logical fashion to help you really plan for your program. We're interested in understanding your staffing plan, how you plan to supervise your staff, how you plan to train your staff, and that includes their qualifications, their initial training, and their ongoing training, what your program plans to do, as well as what your organization does with its staff. We're interested in your plan for recruitment. What are you going to do to outreach to bring those families that you're proposing to serve into service, and how are you going to sustain enrollment and sustain family engagement? We want to hear about what your home visiting content will look like, what your caseload anticipated to be, the screening approaches, and referrals. Oh, we're really heavy. Going. Is everybody hearing everything okay, or are you experiencing feedback or audio issues? People can't hear it, they can't hear it. They can't hear it. It sounds like static. Let's see if we have questions. So when you're talking about the implementation plan, I'm just testing to see if we're still having technical difficulties or if things are getting worked out. Better now.
Okay, keep going.
Okay. So back to the implementation plan, number 5 in your application. I think we were talking about home visiting content, screening, and referrals. We're also going to ask you a little bit about your plan for data collection and reporting, or if you already what your current process is. And then we'll ask a little bit about your program quality and fidelity to your program model. In all, if you are currently managing a home visiting program, this should be more of the same. So you're just going to tell us what it is that you do, but how you're going to expand what it is that you're doing. How you're going to incorporate these additional cases into your program. Everything that you propose in your implementation plan needs to align with your proposed budget. So it's important that when we see your implementation plan and then we see your budget, that they work together. For example, if your plan says you're going to hire 2 home visitors and a half-time supervisor, that we would see 2 home visitors and a half-time supervisor under the payroll section of your budget. If they don't align, we won't know how to interpret your proposal. And so I would say that creates some question about, we won't know actually what you're requesting. And so by having that misalignment will hurt your chances of going further. So anyway, that's really, really important. So it's be thinking about if you're hiring staff, what kind of, how much training plan is going to be, and your associated costs with hiring staff, if you're going to have travel, that kind of thing. So let's move to budget, since I've started to move to budget anyway in my conversation. Section 6. Now the budget, section 6, is actually an Excel template that we've provided. This is really important. We ask that you use the Excel template provided and that you keep it in Excel, that you do not translate that into another version or put it into a PDF. So when you submit, make sure that you use that template and you preserve that Excel format. Within the template, you'll find 2 tabs, a 7-month expansion ramp-up tab and a 12-month ongoing annual budget tab. They're identical, except for that they have these 2 different names, and they encompass 2 different time periods. You need to complete both budgets, one for the first period, the first 7-month period of the proposed contract, starting December 1st through June 30th, and the second July 1st, 2019 to June 30th, 2020. We're asking that when you name your budget file, you put your organization name in the name of the file. So that will help us keep your application materials together. So put your organization name in the name of your budget file. One thing that you need to know too is that we allow for a 10% indirect rate unless you have a federally negotiated rate already, your organization. If you do have a federal rate, then you must submit your certification accompanying this budget. If not, if you don't have that certification, you're eligible for 10% indirect. We're going to spend a lot more time on this, on the budget at the webinar on August 29th. But again, it's really important when you develop your budget that you look back at your staffing and your program implementation plan and make sure that they work together and that they mirror each other in terms of what you're planning to do and the resources you need to do what you're planning to do. All right, number 7, supporting documents. So we have a list here of supporting documents that you'll need to submit alongside your application and budget. Please note that if there's an asterisk next to that, it means if you're already part of the HVSA receiving funding from DCYF through a contract to deliver home visiting services, you've actually already submitted these, and we don't expect you to submit them again. But if you don't currently have a contract with DCYF, we will need you to submit these documents. All as part of your application packet. The last bullet on this list is a model fidelity letter. So for those of you who are new to the HVSA, what that means is somebody from your national program model, a technical assistance provider, will need to basically authenticate that you're running your program with fidelity to that model. If there is no national technical assistant, you may contact Thrive at the hub, and that email was on an earlier slide, and request a model fidelity letter from them. I think Isidro would do that. If you have any questions about this, please, you can either contact Thrive or you can contact us at the Home Visiting Inbox. This is something that would be really good to get working on sooner than later, since that's a dependency on another organization to respond. Okay, next slide. So remember, we have 7 application components. They're all due together in one electronic packet, so you can send one email with a lot of attachments by 4 p.m. on September 21st to this email address, home.visiting@dcyf.wa.gov. We're asking that you use the Word document that we've given you as an application packet, that you do not reduce the font size below an Arial 10-point font size or an equivalent, and that you preserve the 1-inch margins all the way around. You can submit it as a PDF document, the application, and I actually think that's advisable, because we don't want to accept an application longer than 30 pages. We've provided a kind of recommended word count underneath each of the question response boxes. You don't have to follow those word counts, but if you do, you will be well within the 30-page limit of this application. So that 30-page limit doesn't apply to your attached budget or to your supplemental documents. So again, it's sections 1 through 5 must be up to, but not more than, 30 pages long. And then you would also attach your budget Excel file with your 2 tabs and all of the supplemental documents requested by the 4 p.m. September 21st. This is the process that the HVSA uses to review applications. So first thing we'll do is just a compliance review. Make sure you actually are eligible, make sure your budget and your implementation plan align, make sure that all of the eligibility requirements are met, and then we will we'll facilitate a process of peer review amongst individuals who will then review and score each application. Once those folks have individually reviewed applications, we bring them together for a review panel and score all of the applications. From there, we'll create a slate of finalists. We're going to ask finalists to make or participate in a 2 to 3 hour presentation and a question answer session. So each one individually. This will occur either on site if you're a program that we have that's not being funded out of the HVSA right now, or through either an audiovisual or at the DCFYF offices here, or at a location that we can mutually agree upon, so that we can hear more about your program and ask you some questions and give you a chance to really explain more deeply your proposal. Finalists will be given at least 7 days advance notice of the presentation timeframe and the content expectations, and then you have an opportunity to negotiate when that presentation occurs. But it will happen during, I think it's laid out in the key dates slide later on when those will occur. We hope to make funding decisions by the end of October, but we'll use all of this information that you've presented to contribute to that funding decision. All right, next slide. This is just a reminder that while this bidders conference has been intended to explain the application process and the background, that there's 2 additional webinars that are going to be held over the next couple weeks that there are opportunities to learn more about the topics within the application. So first, on Tuesday at 1:30, there's a webinar that we'll be hosting on organizational, contract, and fiscal expectations. And then on September 5th at 9:30, Department of Health will come in and we'll be running a webinar on monitoring and data requirements to include a more in-depth discussion of the needs assessment to support your application. All of these webinars are listed on the web page, and you can register just exactly like you registered for this one. All right, slide 36, Q&A. So this is if you need any additional support or something's not clear. And certainly we're going to try to address some of your questions today. Any questions that you have, including those that you asked today, will be included in a Q&A document, and we'll produce a frequently asked questions document with responses. We're asking that you submit questions. If you ask them today, they're considered submitted, but you email your questions. If not, you can also email questions if they occur to you later. Anything asked up to 5 p.m. on September 7th will be consolidated and responded to in our FAQ document that we will post by September 13th on the website, the DCYF home visiting website. If you have questions about model fidelity, then we're asking you to actually contact your model or TA provider or Thrive. I'll talk about that in a minute. So, and here's the website, or the email address for Thrive is up here on this slide, hub@thrivewa.org. Okay. The next page just lists all the key dates. These are present in the application guide. So with the key ones being that the letter of intent is due on the 30th, and the application itself is due on the 21st. We'll be conducting a review between September 24th and October 5th, and identify finalists by the 10th of October. We'll make finalist presentations during the week of the 5th, or there's 2 weeks actually, the week of the 15th to the 26th. Oh, here with announcements late October, early November. Again, we want to execute contracts beginning December 1st. All right, the next slide. This is the chance now for you to ask questions. So we're asking that you chat your questions into the chat box, and what we will be doing is reading them out loud and attempting to respond. All the questions that we receive will be incorporated into a FAQ document, and any questions that we can't answer today, we'll certainly answer in that FAQ document, along with any answers that we provide today. So, Yes, so I'm ready for questions.
Okay. In which section showed to outline the partnership and collaboration with the beneficiary community? Do you require partnership letters?
No. We don't require partnership letters, but in several places we've asked you to talk about what's going on. I think in, I'm going to open up the application questions. I think in the, in the section on community need, community profile of community to be served in section 3, under the existing home visiting resources section, there's an opportunity there for you to talk about what's going on collaboratively within your community around home visiting. Have Renee repeat the question. Okay. I can't repeat the question.
For the next time.
For the next time. Okay. I don't remember the question, but I'm answering the question, so I must remember it in part. So there's a couple places though where you can answer the collaborative, what kind of collaborations are going on within your community without having to submit letters of collaboration. So one would be in what we're calling section B of section 3, profile of community need. And then also there's a systems section within your implementation plan that talks about systems connections. And there's another place there for you to talk about how you're coordinating with partners. So next question, Yvonne.
Okay, so there were multiple questions asking clarification on the slide with the ramp up, and folks are interested in, let's see, let me just read this one to you because it kind of has it all. The slide makes it seem as if 200K is for the 12th month, is the second term, and does not capture the cost of the 7th-month ramp up. Is that correct?
Yeah, so it would be, for example, and this is just rudimentary. I'm not really probably supposed to go into examples, but if you can apply for up to $200,000 for a 12-month period. So the December 1st through the June 30th is a 7-month period. So you would think, what's it going to cost during that 7-month period to eventually implement a $200,000 program for 12 months in the next 12-month period? So that may be 7/12 of that program, plus additional training costs or additional supply costs that you might need to incur to get the program up to full speed. So it probably wouldn't be 200 for the first 7 months and then 200 for 12 months, because really you wouldn't be able to sustain a program at that level with only $200,000. So yeah, so what we're looking at is we have an annual budget for each program of up to $200,000. But the first year is short of that. But the first year also includes potentially other costs that you wouldn't see during the ongoing 12 months. I didn't repeat the question. Sorry. I got it. I'm a learner. I'll have to learn the next time.
And it's 200K a year,
First.
not 400.
It's 200K a year, not 400K for the total. So we're really asking you to think in discrete chunks, 7 months and 12 months. So the 12-month budget is not set in stone, but the total is. So we're asking you to show us what you think your 12-month ongoing budget will be, but we'll have an opportunity to talk about that in the spring. So, but that gives us a sense of what your ongoing budget will look like.
Next question. You stated a goal of awarding 25% of available funds to promising practices. Can you please clarify whether you expect that to mean $250K of the $1 million for expansion funds to promising practices and $125 of the $500K set aside for startup?
Yes, thanks for that question. So this question around 25% will go towards research-based and promising practices models. That 25% is really across the whole 1.5 million. So partly why we want to see your LOI is to get a sense of, well, how is that being distributed right now amongst the applicants? And I think what we're going to have to do is figure out our aim is 25% across the whole. So it's not, it might not mean it's exactly 25% of each procurement. It might be more in one or the other. So it's not that 25% is across the 1.5 million. So that would be 375,000, I think. Yeah, across the total, not across each individual bullet. Don't ask me the specifics about how we're going to do that.
Okay. Ready?
Yes.
Next question. Is it possible to apply to expand across county boundaries when collaborating with an agency for referrals in that county?
So the question is it possible to apply across county boundaries? Absolutely. You define your community and you define your community need and you justify that expansion and you justify your ability to serve that community. So it's up to you.
And the follow-up to that is, are they eligible to apply for more than 200?
Are you eligible to apply for more than 200? Every application, no. An application of more than 200 will not be accepted. Even if you're working with multiple counties.
Next question. Is it allowable for an applicant to apply for both the expansion and startup applications?
So the question is it allowable for for an organization to apply for both the expansion and the startup? So the eligibility criteria for expansion are that you've been in existence at full implementation for at least 12 months, implementing a model on that list of eligible models, and you plan to expand your number of slots. The eligibility for startup, which we'll talk more about on Monday, is you have not been implementing a program for 12 months. You're at the startup installation phase. And we'll spend time talking about that startup installation phase on Monday within implementation science. So what that means is you've gone through a community planning process to identify home visiting as the need in your community and a specific model that comes to that. So it's conceivable that you could ask for expansion of home visiting dollars within an existing model, and then you want to start a new model in your community because you think that model would also meet a community need that's not being met by your current home visiting. So it's conceivable that you could apply for two, but you're going to have to meet two completely different criteria to do that.
Okay. Next question. Can you confirm the funding stream information? Are there federal funds included in this expansion opportunity?
Okay. So the question is, can I confirm the funding source of this expansion? Are there any federal funds? The answer is the funding source for this expansion is 100% state funds. It's the legislative authorization that came down from last year's legislative session. So while the HVSA receives federal dollars, those dollars won't go into any of these contracts. But it's all a big family of funding, and so we coordinate and try to keep things aligned. But that your fund source would be state dollars for these funds.
Okay. Next question. Our current award amount does not fully fund the families we are required to serve. When requesting expansion funds, should we use current funding and enrollment expectations as a guide or request the full amount needed to serve the amount expansion families propose?
That's a good question. So our current, it's kind of a complicated question, but our current award does not basically cover all of the costs needed to serve those families. And so should we use that as a guide going forward, I think is the question. What you want to do is make sure that you build a budget that supports the proposed number of families that you serve. We have a good sense of that, and we see that across the portfolio of programs, what that takes. And so we certainly don't want you to build a budget that doesn't fund yourself. So what you can't do, though, is backfill your current program gap with these dollars, unfortunately. So you'd have to serve new families with these program dollars. I don't know if that answers your question or not, but. So we build your budget that's realistic and supports your program. Recognizing that we can't guarantee a funding increase, so over the years. So that's something that you need to build into your picture of sustainability.
There are no more questions at this time.
Great. Should we wait a few minutes? Yeah. I think a couple things I will say, even though I'm not a newscaster and I'm really bad, obviously, at flying, going on the winging it, it sounds like we're going to need to re-record this webinar. The slides are available now, so you can see them anytime. I would say that the application guide that we gave out is a really good resource to answer any questions that you might have, and so study that. It's worth your time, because both it helps figure out how to answer questions, and it gives you some hints in terms of what we're looking for. It also might help you decide whether or not you in fact should apply. There's more webinars that we're going to have. Hopefully we won't have this much difficulty technical. This has kind of been an interesting one. And any questions that, if you hang up and in 10 minutes you decide I have another question, just send a question into the home visiting inbox. What we're asking that you do is identify this question as related to this procurement, so that we know we're going to have separate FAQ documents for the expansion and the startup, so that we can figure out how to tease those apart for you. Recognize that it's a little confusing. You're running two procurements at the same time. It is at our end. I'm sure it's super confusing at your end as well.
One more.
Okay, we got another question. Yay.
The guidance mentions 10-point font and 11-point font. Which do you
Oh, shoot. Well, we'd love 11-point font, but you can go as small as 10-point Arial. Okay, so not Arial. Recognizing that there are some fonts that shrink a lot smaller. So it's just a kindness to our reviewers to have it be 10 or 11. We give you the choice. So how about that? And I think there may be they're not, but I feel like I've maybe found some differences, and something might be due at 4 or 5. If we have that discrepancy, we will honor whatever the latest date is that we put in a document. So if we've missed if there's some details like that where there's some internal conflict.
On September 5th, that one starts at 9:30, not 10:30, like the guidance says.
Oh, does the guidance say 10:30?
Guidance says 10:30.
Oh, I think we moved the September 5th webinar to 9:30 because actually we couldn't go to webinar after we publicized it in the application guide. So the data webinar will start at 9:30, not 10:30, even though the published document says
just the guides.
in the guide, but on the website it says 9:30, and if you register for it, it says 9:30 in the GoToWebinar site. So
Next question.
yes.
Will the contracting webinar discuss DCYF's moves to performance-based contracting, if that will be used for this procurement?
That's a really good question. Will the contract discuss DCYF's move to performance-based contracting? Technically, home visiting is being considered as a pilot program for performance-based contracting, because one of the elements that we include are performance payment awards. So we will allude to performance-based contracting, but we won't go into detail, because we haven't actually figured out the details here at the department. And that's something that, as a whole system, the HBSA is going to be learning about over the next year. So we will allude to performance-based contracting. We do have performance payments. Typically, well, it'll be interesting to see, because you all are expanding. So for new programs, we tend to not include performance awards in the first year, because you're ramping up and trying to meet performance standards. And so we haven't actually figured out if what performance awards will be relevant to expansion applications. But so I'll mention it, but at this point, we're not quite sure where performance-based contracting is landing in the department, but it definitely is coming. So.
we build a budget based on what it takes to deliver the program and only the HVSA award cap is provided, will DCYF allow for a downward adjustment to caseload until other funds can fill the caseload gap?
So that's a really, really good question. I can't completely answer it. It's if we build a budget to serve basically a given caseload with a $200,000 cap, and we don't see an increase in funds, basically like a cost of living increase over time, will we allow for a reduction in caseload? And I will say you could probably talk to current HVSA contractors. That's one of the reasons why we ask you about your organization's commitment to home visiting and sustaining slots despite a potentially not a lack of increase in funds. So that takes some internal exploration within your organization if you're willing to sustain that level of service with essentially what might feel like a declining funds because the value of those funds goes down even if the total amount stays the same. We are held to our slot requirements by our funders. So we're squeezed just like you are in terms of not the expectation to continue to serve that same number of families without increasing the budgets. So basically my answer to your question is we can't answer that. We'll always entertain a negotiation, but we often cannot reduce slots. So.
There's a
Follow-up question.
Actually, that wasn't about COLA. It was if the cost is $250K to deliver full caseload, but only $200K is awarded, and agency does not have $50K to fill.
So if the cost to deliver a full caseload is $250K, my question back to the questioner is why is your caseload costing $250K? Why don't you're setting your caseload in this application? So your caseload needs to fit within model requirements and model expectations, but I'm thinking you're building a budget that supports your caseload and not exceeding your caseload. Or wait, your caseload exceeds your budget availability. So either that or I'm not understanding the question. So I think right now we're asking you how many families you can serve. So you're in charge of that, telling us what that is.
All right. Next question. Beyond the 25% earmarked for promising practices or research-based programs, will there be an effort at diversifying which home visiting models are funded at the different successful sites?
I think I don't really understand that question. I think, so the question is, beyond the 25%, will there be an effort to diversify home visiting models? If that means outside of the list that's provided, probably not. The answer, but I'd have to probably go and talk to the larger policymaking body around that. But so I'm not quite sure if that's what the question is or not. So I don't know if the person can clarify. If it means models other than those on the list.
Do they just mean beyond NFP and PAT?
Well, beyond NFP and PAT are the evidence-based models, so they're talking about beyond the promising practice and research-based models.
Okay, follow up.
Yeah.
Not outside of the provided list, but among those models included in your list, will there be a concern if too many successful sites are all offering the same model?
Oh, that's a really good question. I think I can't actually answer that question. Again, I can talk to folks. What we're trying to make sure is that we hit at least 25%. So if there's more, that's a good question.
That other 75%.
Right.
Are you going to focus on diversifying from the list that we have provided? I think is what they're asking.
I think it's basically, are we willing to go higher than 25% for promising practice? That's how I'm reading it. So are we going to,
I mean, among the 75% outside of the promising and research-based. Do you want me to start over?
Yeah.
Okay. Beyond the 25% earmarked for promising practices or research-based programs, will there be an effort at diversifying which home visiting models are funded at the different successful sites? Follow-up. Not outside of the provided list, but among those models included in your list, will there be a concern if too many successful sites are all offering the same model?
Oh, I see. Oh, okay.
Follow-up. I
Yeah.
mean among the 75% outside of the promising and research-based.
So they're talking about evidence-based in the 75%. Okay. Well, no, I don't know the answer to that. I'll have to follow up on that. There aren't that many models to choose from to be diverse from anyway within the evidence-based list. So
We had one thank you comment.
oh, that's nice. Thank you very much. Sorry for all the technical difficulties.
And there are no additional questions at this time.
What time is it? Oh, wow. So we were under an hour and a half still, despite all the challenges. Well, again, I apologize for all the challenges, and I'm like the most nerve-wracked person when we have technical challenges because I'm not the most technically savvy person. Thanks to Yvonne and Kira for helping support. Thanks to Liv for taking on a piece of this. And we'll redo this. Oh yeah, poor Kira. We will redo this, re-record it, and post it on the web, but the slides will be up on the website soon. And thanks again for your questions. Thanks for your attention, and thanks for the work that you do out in the community. What we wish we had a lot more money that we could be giving out, because it's hard to see all of this work and all the energy that's going to go into your applications and realize that we only have $1 million to give out, and I'm sure there's many more fold need, as we've seen, and the good work out there that we'd like to be able to support more of it. So thanks again, and take care. Maybe I'll be talking to you all on Monday too.